Hello everyone, this is Dr. Sam, and today we will learn about DWI and ADC MRI appearances of glioblastoma. Today we will only focus on the DWI and ADC image findings of glioblastoma. Diffusion-weighted imaging, or DWI, and apparent diffusion coefficient, or ADC, sequences are essential MRI tools in evaluating glioblastoma, the most aggressive primary brain tumor. DWI measures the movement of water molecules within tissue, while the ADC map quantifies that movement. These imaging features must always be correlated with T1, T1 contrast, flare, and T2 sequences. Let's start with how a glioblastoma appears on diffusion-weighted imaging by comparing it with normal brain DWI appearance for a good understanding. The B-value is a number that controls how sensitive the scan is to the movement of water molecules in the brain tissue. A low B-value, such as 0, means the image looks similar to a regular MRI and does not strongly detect water movement. A high B-value, such as 1,000 seconds per square millimeter, commonly used in brain imaging, makes the scan more sensitive to diffusion, so areas where water cannot move freely, like very dense tumor tissue or acute stroke, appear bright on DWI. This image is taken at a B-value of 1,000 seconds per square millimeter. By comparing images taken with different B-values, the MRI machine calculates the ADC map, which shows the actual amount of water diffusion in the tissue. In simple terms, the B-value is the setting that controls how strongly the MRI highlights restricted water movement in the brain. A B-value of 1,000 is usually used for brain imaging. On the left is a normal DWI image of the brain in the axial view. The outer gray matter of the brain will appear bright on DWI. The inner white matter will appear slightly darker or hypointense than the outer gray matter. The CSF-filled structures such as the ventricles and the sulci appear very dark. Normally, no focal areas of very bright signals must be present. On the right is an image of a glioblastoma. This image is blurry because the B-value is high. As B-value increases, the image gets blurrier. This image might be close to a B-value of 3,000, because for brain imaging, the B-value range is often 0 to 3,000, with the best evaluation at 1,000. There are two main features to note in DWI: a solid tumor component and a necrotic hemorrhagic component. The solid tumor component of the glioblastoma will appear bright, hyperintense. You can see this region is brighter than the brain tissue. It appears bright due to high tumor cellularity. The necrotic component, which is often consisting of hemorrhage or a cystic degeneration, will appear hypointense or dark, because necrosis allows free water diffusion. DWI shows bright signals in regions where water molecule movement faces some resistance, such as solid tumor components. In this region, the water molecules move freely, so we will get a dark signal wherever there is free movement of water molecules. Sometimes the necrotic component may appear isoechoic to the normal brain tissue if it is small or subtle. Other findings, such as mass effect and a midline shift, are present, but these are evaluated in other sequences. Do remember that DWI and ADC images alone are not enough for a diagnosis. We must always compare these images with T1, T1 contrast, T2, and flare. Now we look at ADC images. In the normal brain, the CSF-filled structures will appear bright, such as the ventricles and the sulci. The white matter has an intermediate signal with medium-level brightness. The outer gray matter will appear slightly darker than the white matter, but it is very subtle. On the right is the same case in ADC. The solid tumor component that appeared bright on DWI will appear dark on ADC, although it is hard to notice in this case. ADC is used to confirm the restricted diffusion seen on DWI. It acts as a supplementary view which helps in diagnosis. The solid tumor component must appear dark on ADC. The necrotic component appears bright on ADC. Fluid-filled areas appear bright on ADC. It represents facilitated diffusion. This area appeared dark in DWI and appears bright on ADC. Peritumoral vasogenic edema can be seen in an ADC image. It appears bright but less brighter than the necrotic component. Let's look at more cases of glioblastoma in DWI and ADC images. In this case, we can see two components of the tumor component and the necrotic component. The solid tumor component will appear bright on DWI. This is the solid tumor component. It appears bright because it has restricted diffusion. The water molecules do not move freely because of tightly packed tumor cells. DWI enhances these areas and they become bright. The necrotic component will appear hypointense on DWI. It appears dark because water molecules move freely in this area. DWI causes these areas to become dark, and there is no restricted diffusion here. Overall, it has a heterogeneous appearance. In this case, there is a small mass noted. The bright area indicates the solid component of the tumor. There is a small dark area adjacent to this solid component. This is the necrotic component. You may also see vasogenic edema on DWI, but it is more prominent on ADC. The edema appears slightly bright because of swollen brain cells which lead to some resistance in the movement of water molecules. It appears somewhat isointense to the outer gray matter. On ADC image of the same case, the solid component which appeared bright on DWI became dark on ADC, confirming the restricted diffusion expected in the solid component. This dark region is the solid tumor component. The necrotic component which appeared dark on DWI will appear bright on ADC due to easier diffusion in this area. The vasogenic edema is more clearly seen on ADC, appearing as a bright region surrounding the tumor. Let's look at another case of a glioblastoma. The solid component of the tumor will appear bright on DWI, and the central necrotic component will appear dark. This is the ADC image of the same case. The solid tumor component which was bright on DWI has become dark on ADC, and the necrotic component which was dark on DWI has become bright on ADC. ADC confirms the restricted diffusion seen on DWI. The edema gives bright signals, but they are not as bright as the ventricles. Thank you so much for watching. Stay tuned.